Thank you. I appreciate that. And I want to thank you all for being here today. When I first got to Congress and I'm diving into these issues on health, I thought, man, we must have a lot of really bad doctors in our country that are doing bad things all the time. We better crack down on them. We better make sure they're doing the right thing. And so all these programs, okay, I guess maybe we should incentivize good outcomes. I guess we need to do that because maybe people aren't doing the right thing. I didn't find that in my community in Cincinnati. If there was a bad doctor, it generally rose to the surface and you knew who it was. And it took care of itself. They either lost privileges or their society came down on them. That's all it took. The threat of malpractice is enough for you to adhere to community standards and do the best for your patient because you're an entrepreneur. And the only way your business grows is by taking care of people and doing it well. We have gotten way too involved. And I understand the value of positive outcomes. That's how your practice grows. I never cared what Washington thought. I thought what my referring doctors thought. I thought about what my patients thought and what the community thought, what my reputation was. That's what drove good outcomes. Nothing Washington did had anything to do with those successes. And we in medicine today do not put enough value on the healthy human life. That's where the savings comes, is the healthy human life. I so appreciate you, Doctor, I'm going to mispronounce your name, Dr. Chenard, and I've covered Appalachia. I know what you're talking about, and I so appreciate what you had to say. I'm a co-lead on the Value in Healthcare Act, and it's a bipartisan bill, and I think it makes some changes to the program parameters. But even if passed, it's going to need review. Because if we're doing something that just, what I've seen over my time, my pay kept going down in fee-for-service. And I didn't give up on my time with the patient, because that to me was sacrosanct. But it did increase paperwork, and it did increase costs within my office. And yes, thank you for that, because it's very scary. Anyway, but the value of the healthy human life is unbelievable. I know when I first took my kids to a pediatrician, I was like, I came here to this practice. They said, we might have your chart in the basement. They pulled out the chart. There was a 3x5 card stapled in it, and it had the date, and it just said, okay. And guess what? Doctor kept me healthy. And when there was something to be done, it was more to it. But we've gone so far to documenting. The real document is how that patient feels at the end of the day. That's all that matters, and that's what we should be concerned at. So prevention is key. You talk about how do I increase my admissions and fill more beds and do all this? That's not the answer for the future. It's not. I'm a podiatrist. Arizona one year thought it would be great under Medicaid to drop podiatric services. Guess what? Their costs went way up because we do a lot of prevention of ulcers, and we're the first to detect vascular disease, neuropathy, things like that, right? Congestive heart failure. We get patients into the right care. That went away. Their costs went way up. Amputation soared. They begged them to come back. But this is where the savings is in the value of the healthy human life. I say to insurance companies, why don't you incentivize? If you have a group, a business maybe, that has 100 insulin-dependent diabetics, maybe you put into the plan that they have no copay 3 times a year to go to their doctor. You'll probably prevent hospitalizations and increased costs.